Okay, good afternoon. Thanks so much for joining this webinar on the upcoming changes to lab orders in Galway. We will be covering an overview of those changes in Galway, along with any prerequisites. We'll have a demonstration and then some Q&A at the end. If you do have any questions, please feel free to put them in the chat and we'll pick them up as we go along, or we'll just answer them at the end. I'm joined by John, the support lead for Health One, who will be leading the demonstration, along with colleagues from across the HSE, HealthLink, and Galway. This webinar is also being recorded and will be made available later as well. So, with all that said, over to you, John.
Hi everyone, I'm John here. I'm just going to do a quick demonstration on how to do a lab order in the Health One software here. So just to start off, I'm just going to share my screen here so you can see what's going on. So just to start off here, there's a checklist that you'll get before you do the lab order there. This mightn't be exactly the checklist that you get there. I think that still has to be sent out, but it's basically the same thing for ourselves anyway, for the software part of it there. So you'll see there's a few kind of questions you'll need to answer, and I think you'll have to do a test lab order as well and send that in before you actually start doing it there. So there's a few things here for ourselves for Health One. Number one here is the latest PMS software version. So I'll just go into Health One here just to show you where you would check that. So if you want to know what version you're on, if you look up in the top left hand corner here, you can see your version. If you want to check if that's the latest version of the software, if you click on Help and then click on Web Update, it will live check and see if you're on the latest version of the software. If you see a green tick beside it, you're good to go. If you don't see a green tick, just click refresh and it'll pull down the latest version of the software for you. And if you close that window and close Health One, it should install it for you. Now, second on that there, all users will need to have a HealthLink certificate on their system to be able to do a lab order there as well. So to find out if you've got a HealthLink certificate, if you click on Tools and Options, and you'll see down here about halfway, you've got HealthLink sticking out. So if you do get a new certificate from HealthLink, you can pop in the username, the password, and the PIN for that, and you can select it by clicking on the drop down here, whichever one you need, and click OK. Also, you'll need a default printer set up on the system there. So every PC that you're going to be doing lab orders from will need to have a printer attached to it that you can actually print off the lab orders. So when you have the printer on your system there, you have to select it up inside a Health One by going to File, and then Print Setup, and then selecting the printer by clicking on the three dots over here on the right hand side, and selecting whichever printer it would be in the drop down. Just to show you again, click OK, and click OK again to select that printer. So now I'm just going to go through doing a lab order for a patient. So I have a test patient set up here, so I'm just going to go into that patient there now at the moment. So now just to show you their demographics here, if you click on this here up at the top of the screen, you can see their administrative data. And of course, with a real patient, they would have a real IHI number, and you can check that by clicking on this little guy here to check their IHI. Obviously, this patient doesn't have a IHI number because it's a test patient. You can also change any demographics in here if you need to as well. One thing I would mention is a patient's name. It's best to have it in the format like we have there, just first name and surname. The system doesn't like dashes or brackets. So if you put in say somebody's name and then put something like other after it, system won't like that there. You're as well just having the real patient's name there. So if you have any patient where you can't maybe do a lab order, that might be a reason why. Now I'm just going to go through doing a lab order for a patient here. So this patient is a diabetic, as you can see up in the top left corner. So I'm going to do a lab order for this patient now. And there's two places you can do that there. Number one, by clicking up here and clicking on HealthLink Lab Request. Also, if you go into Lab Request over here on the left-hand side and click this icon, which is the same one. It'll also pop in a lab request there for you, or sorry, a lab order. So if I go with health and lab request here, so this is the screen that it brings up here where you can select the doctor in question. If you click on the drop down, if there's any other doctors there, you can select them. If you're a nurse, say, you can pick up a doctor's profile to do the lab order. So then you want to select the hospital, which in this case it'll be University Hospital Galway, and the referral, which is lab order there. So this patient testing lab order doesn't exist on the University Hospital Galway side of things. So in this case, you go create new patient. If you're doing a lab order, say in a month's time for the same patient, they might exist on the University Hospital Galway side of things, and you'd probably get a list of patients here that you could select the correct one to carry
Sorry,
on there.
John, can I clarify that one?
Yeah,
That won't happen for lab orders. It'll always pull the information from the GP system because it'll be the one that'll be most up to date.
right.
So they'll never that we have a request
That's
in to
been gone away
change
for
that
Right.
link to next.
Right. Okay, so we'll just go create new patient then. So this brings up the lab order window there for you where you can do the lab order. So you've got your demographics up here at the top for the patient. You've got your GP out of hours number here, which you can pop in basically your own number if you need to there. And the one thing you have to do is fill in the clinical details to do a lab order there. So I'm obviously not a doctor, but I'm going to pop in that there. So if we go further down here, these are the basic labs you can select there on the system. Now there are different priorities there. As you can see, there's different labs you can select. So these are the labs that have basically been agreed are the most likely ones to be selected there. So in this case, I'm going to choose a HbA1c and a lipid profile for this patient. Now you've got the date specimen collected there, so this is editable, and the time the specimen was collected. So say if you did it on a Friday, for example, and you actually didn't get around to popping it up until Monday, you could change the date there to a few days ago, and the time selected as well. You can edit that there. As you can see, you can also set your priority here to routine or urgent if needs be. And you also have antibiotic therapies here. If you want to select them, you can do. So if you're happy with these labs that you've selected, you can click on review to review the lab order you've done. So these are the ones you're going to do. If you wanted to amend that, you can click on amend test. If you're happy with it, you can click to order here. So if I click order, this shows you what you need to pop into the bag to send off to the lab there. If I click OK on that there, so it'll pop up with what printer you want to use there, your default. And there's your lab order request that you'd actually be printing off there. So if you're happy with all that there, you can click on close. And it pops the lab order in there. So you can see here is the lab request you've sent off. So say if you needed to come back in a week's time to reprint, say your printer wasn't working or whatever reason like that there, you can double click on that and it opens up the lab order for you where you can print it again if you need to. Also, when the lab request would come back, you will see a green tick. You can see there's a little, if you've good eyes, you'll see there's a little egg timer there, but it'll turn to a green tick when it comes back there for you.
Just to say that's only when the acknowledgement comes back, not the result itself.
Right, so basically that is how you'd pop in a lab order for a patient there. So I'm just going to go back in here now to a different patient there. I'm just going to show you another thing on the system there. I'm just going to save that. And I have another patient set up here. So actually in this case, going to go into an older transaction here. I'm going to pop in a lab order here. I'll actually do it over on this side just to show you it's the same. Actually, I might just do it.
Actually, I think that the prerequisite is, John, that if it's different days, that you'd make a new transaction for whatever lab order you'd be placing.
Yeah, that was
So
what you
they'd
were
come
just gonna
back
show.
individually.
So you see there, the selected transaction, do you want to continue? So it just gives you one. If you don't want to continue and do it in the correct day, but you could go with that there. But I'll just do it as if it's a new one there. So it's the same thing again here. University Hospital Galway and the Galway lab order, and create a new patient. So you get the same window here again. So this I'm just going to show you, there's a way of creating favorites on the system here as well. So if you just select this drop down, if there's any favorites there, you can select it. So there's one here, routine bloods. And basically that'll pop up those ones for you if you wanted to use them. I'm just actually going to go and test on this because I want to remove those. I just want to show you, you can see how easy it is to remove one if you needed to. Just going to show you how you create a favorite if you needed to there. So the favorites is basically just a way for a practice to have it make it easier for themselves. Say if they're selecting the same labs over different days, instead of having to add them all individually each time, you can create a favorite. You can see I've got one there already called routine bloods, but I can create a new list just by clicking on create new list here. Select University Hospital Galway and then putting in an alias. That would just be whatever you want to call it yourself. So I already did diabetic blood, so I'm just going to go with that there. And it brings you back to the same screen again, where you can select your specific bloods that you want there. So again, I'm just going to go HbA1c and lipid profile. And if I'm happy with those as my favorite, I can click review on that there and save that favorite. And then it'll appear when you go lab order in this drop down here to select up again. You see it pops them straight in there for you where you can commit that order. So basically that is how you would do a lab order in a patient file in the Health One software. Just going to, if you do happen to close out of it, there you'll get that notification there that you've cancelled that one there because I didn't commit that one. So I'm just going to show you when labs come back from the lab, sometimes they might be, say if there was a new lab or something like that there, it might come back as unmatched. I'm just going to quickly show you how you would match up a lab and how you would identify it's an unmatched lab. So how you would identify that it's an unmatched lab would be, as you can see, this is just a result, a test result that came back in here. And you can see that there is one here for HDL cholesterol. Now, how you know it's unmatched is you see this tiny little T beside it on the left-hand side there. That tells you that Health One doesn't know what that lab is equal to yet. It'll still display it to you and show you everything there, but it just won't, it doesn't know what that lab is there, so it mightn't come into, say, a CDM. But you can match it quite easily in the software. You just highlight it, right-click, and then down at the bottom here, you have an option of remap lab item. So this would be something ideally somebody clinical would be doing there. And you can see the lab description is HDL cholesterol. So you're looking for HDL. So you're looking for something on the system that matches with that there. So cholesterol HDL might map with that there. So you just select that and click OK. That would match that lab up for you then. So now Health One would know. So say if that was missing from a CDM, it would then populate into the CDM protocol for you.
And what's the maximum length, John, that they have to be, those codes? Do you know?
I couldn't tell you off the top of my head there, to be completely honest. Mary, it would be a guess.
Okay,
I think it's 100. I'm not sure though. It would literally have to look in the database to see how long that would be there. Now, so I'll just quickly show you if say you did make a mistake mapping a lab there. The mappings are stored here. There's the user mapping. So if you click on that, you can see I've got a mapping in there. If I'm not clinical at all, so I could delete that there, and then the next time the lab comes in, you could remap it again to the correct thing. So I'll just delete that mapping because obviously I'm not a doctor in any way, shape, or form there. Now, so basically that there is really all I have, unless anyone has anything else there they want to add in there.
Just one thing in terms of the collection date and time, the request would be that it would be done real time or as close to real time as possible, because you can't re-edit. Once an order is submitted, you can't change anything on the order that's gone in. So if the collection date and time, it has to be done at the time that the patient is in front and the request is being placed, for safety issues or for processing requirements within the laboratory. Notwithstanding that, if you took it this morning and for whatever reason your system wasn't available, the internet had dropped for some reason or whatever, you could write your form, and then before it would go for your logistics, you could actually put your order in again based on the time that was on the form when the sample was taken. But that's about the only caveat in relation to that. And we do plan to look at the availability of future orders and to be able to hold them for phlebotomy clinics and all the rest of it. But that's not in this phase yet.
All right. Is there anything else from the team, or I don't think there's any questions in the chat. So if there's nothing from the team, we can probably wrap up there.
Okay.
Okay.
Okay, I'll just stop sharing my screen then, and I'll leave it back to you there.
Oh no, there is a question there just in the chat. David says, we use lab analysis to check our bloods. How do we get results?
Right, so I'll just share out my screen again there. So it's in the exact same place. If you're using the lab analysis already, it's going to be essentially in the same place there for you. Do I have a lab order in against any of these? So it's the exact same way you had your lab analysis there. So it still pulls up the same information, and you've got your analysis and your lab request analysis, where you can see whatever ones would be there. This is obviously a test system, so I probably don't have any, because I didn't actually pop anything in there, but they would appear in the same area here as before. And if you've been using the lab analysis, you can just right click and see the status of request and so on there as before.
All right, thank you, John. Doesn't look like there's any follow-up questions there, so I think we're safe to wrap up. Like we said at the beginning, this webinar has been recorded and it'll be made available to you. So if your colleagues weren't able to join us, you'll be able to share this onto them as well. But yeah, that's it. Thanks so much for joining, everyone.
Right.
All right, thanks and bye.
Thank you.